This is Crystal Fenn with MedPage Today. I'm here in San Francisco at the American Society of Hypertension meeting, where two genome-wide studies have reported common genetic variants that appear to be associated with hypertension and blood pressure in the general population. I spoke with the lead researcher on one of these studies, Dr. Christopher Newton-Che from Massachusetts General Hospital.
When we started out doing genetic association studies of blood pressure, it wasn't clear whether there would be some variants that had very strong effects and appeared to explain a lot of the variability in blood pressure or not. And some diseases have been like that. Age-related macular degeneration, for example, has a few common variants that have very strong effects and actually explain most of the variability in age-related macular degeneration. What we found with negative study after negative study is that we need really large sample sizes in order to be able to detect convincingly these effects. And in the global BPGen study, we had as many as 130,000 people whose genotype and blood pressure association results we knew. Well, I think it's pretty clear that collectively the 13 gene regions that were found both by the global BPGen consortium and the CHARGE consortium are truly related to blood pressure and hypertension, and I think that's what the very low p-values can tell us. What's exciting about it is that these new gene regions were not previously recognized to be involved in blood pressure physiology. So this really opens up new avenues for understanding blood pressure regulation and development of new therapeutics to try to treat hypertension better.
However, the researchers caution that there's much work to be done before the promise of these findings is realized.
If one considers just identifying a single gene and the work that is then required to understand how that gene interacts with other genes and proteins in the body, to understand what it means to either increase or decrease the effect of that gene, and the requirements to understand the side effects of medicine or potential medicines that might target that gene, that actually takes many years of effort. So I think this is not a quick turnaround. It's going to take years of effort to both understand and translate these findings into improved clinical health.
So common genetic variants that in part determine risk of hypertension and blood pressure in the general population have been found. Now researchers need to find how to put that knowledge to work. In San Francisco at the American Society of Hypertension meeting, I'm Crystal Fenn, MedPage Today.